between, and I'm excited about it. So I'm actually gonna wash my hands real quick and then get into it. I'm gonna be talking about funding for a health organization. For health organizations and what that looks like. So I got some butternut squash, I have some chicken breast, and I'm thinking of something else to put with it. I think I'm gonna do some asparagus. So most of the time I struggle every day because thinking about what to eat for dinner is just one of those daily struggles. So I'm gonna meal prep while I'm talking about funding on repeat for health organization and what that looks like and how your organization can go beyond desperate cycles and to certainty. Okay, let me actually pull up some stuff that I wanted to talk about. But yeah, I'm making butternut squash. Let's see. So most of the time I'm talking to health organizations who thought they were thriving before all these changes in our executive, from the executive level, right, from the president. And even before then, it's been a big issue because solely dependent on grants for anything in organizations can be a major red flag. And most of the time, organizations have solely learned that grants are the best and only way to fund their existing programs and initiatives. However, it puts them in a bind when those funds are delayed. It puts them in a bind when those funds are no longer, promised, right? Maybe they've been funded for years, and then all of a sudden, for some odd reason, they no longer get that funding. But they fail to realize that it's so much deeper than that. Number one, putting all your eggs in one basket can lead to big issues, right? It's kind of like building your organization. The analogy would be a table, right? A table doesn't just have one leg, right? And if it does, it's very unstable. But a table that has multiple legs has a lot more stability in it. It's pretty, unlikely that it's going to fall over because it has multiple legs, multiple sources, right? And so we're helping organizations, redefine what consistent funding looks like for them, and also how to leverage it long term, how to make sure that is something that comes in consistently, and without solely depending on grants. Now, I think grants are a great way to fund your organization, your health organization. And for those watching, I'm actually peeling a butternut squash so I can prepare dinner for tonight. So I'm just trying to do two things at once. But, I talk to organizations every day, just talk to a national health organization who solely depended on grants, and now their program is no longer open. Their organization is still open, but that program specifically has closed down, positions eliminated, 30 years of experience gone from the organization, which is a major loss to a company. And, we want to help them redefine what funding on repeat looks like without solely depending on grants, beyond loans, beyond, hoping and wishing someone comes through on that contract or that payment on time. Because most of the time, if you're doing government grants, I'm meal prepping, if you're doing government grants or government contracts, that they're always late, right? And so I have worked in government for over 15 years. I've also won and managed $12 million in government and non-government funding beyond just grants. We've helped organizations get millions in funding for their existing programs and services or those that are coming up soon. And we've done that by helping them redefine what consistent funding looks like. Hello, thank you, Sophie. Hey, y'all, hair in your dress. Thank you. It's actually not a dress. It's a two-piece set, but this is like a summer dress, and I thought I'd throw this on real quick for a couple meetings I had training some professionals today. So thank you so much. And I usually don't film in my house. I think it's kind of weird, but I wanted to do something different, and get things done, do two things at once. So meal prepping butternut squash. We have chicken breast and asparagus for dinner tonight. So my husband might actually be surprised because he's usually the cook. But yeah. Also, I'm curious, do you guys know what this number means on your fruit and veggies? It starts with a 4759. It's a dash, or a pound, 759. Does anybody know what that number means? If you know what it means or you believe you know what it means, drop it in the chat. I'm curious. And I'll tell you what it means. Because that number is huge. A lot of my background also comes from public health. I was an environmental health specialist. I learned a lot about food systems, systems change, food quality, food access, food manufacturing. I learned so much about it. So I'm actually going to talk to my husband about that. Like, hey, pay attention to the numbers, right? So the number means that the pound for, if you see anything in your groceries that's pound for, it's not organic. And sometimes it's hard to find organic or afford organic foods, but that pound for means that it's not organic. It's typically genetically modified. It has a lot of, pesticides and additives in it. So I'm not going to die from eating this, but, we would typically get something that starts with pound 9. So 9 for this type of code that you see on your food, 9 means that it is organic, okay? And so companies can't lie about this number right here, pound 4729, or that might be 59. Yes, that means that it's not an organic food. And so you want to try to buy organic as much as you can. So yeah, I just thought I'd share that. But yeah, just talking about funding for health organizations. There's so many organizations who also, it's interesting because when I became a business owner in 2018, I had a nonprofit mindset. And a nonprofit mindset, I mean by most nonprofit leaders, just because they have a successful nonprofit organization, they're not a business owner. They don't think of nonprofits as a business, which they are a business. And so when nonprofit leaders are forced out of their role and forced into starting their own business, they really sell themselves short and they end up in the same positions as the original nonprofit did in the first place. So switching from nonprofit to for-profit doesn't change a lot unless you're learning and trying to become business minded. I don't have a degree in business. I believe my business is considered successful. And it's really interesting since coming from nonprofit, a lot of these nonprofit leaders are still stuck in the nonprofit mindset. So they don't think they should charge for services, but the organization has to run. They think that solely dependent on grants for the for-profit or the nonprofit is the only way to go, and it's not. And so a lot of them are closing, and they're risking the livelihood of their staff and the community who depends on these services. And so I'm here to help them get funding on repeat by helping them diversify their funding sources in a variety of ways. And sometimes that might look like building an online course, having the actual community pay for services that are still affordable and accessible, but you're still bringing in revenue. Because a lot of the times, organizations who have programs, they want it government funded. And with the government, they can delay their payments. They cannot pay you, right? They can pay you super late. I was just talking to someone today who had a government contract and they haven't been paid since like summer of last year. And I'm like, are you kidding me? No, that's not, I don't care. That's crazy. And they think that's okay. They think that should be allowed and that's normal, and it's not. I've done government contracting since, 2010 or sooner, and that does not have to be the reality, but we're allowing it to be the reality because somebody else who they're paying through that government contract, they're not getting away with that. So I think that also as leaders, we have to set better boundaries for organizations that we're doing work for and require payment to be on time. Okay. But that's one of the downsides of working with government contracts too, because they are always late. I mean, I've worked with plenty of government contracts and most of them are late. And most of the time their contracts are non-negotiable. You have to accept it as is, which is unfair to both parties. Well, it's one-sided, so it's unfair to the party who's serving the organization. But again, organizations are waiting a year for money that they were promised a year ago, and now the organization is about to close, or they're having to let go staff, their capacity isn't the same, and they're in a struggle. They don't know what to do because they never prepared for it in the first place. We have these companies who are helping them build plans and processes, but what happens after that? If the process isn't being used, or the person doesn't know how to use the process or the system, or they don't know how to execute the plan to get the return on investment or to really reach the people they aim to serve, it's ineffective. It's ineffective. So we show organizations, we actually do it for organizations. We help them build out a financial, plan to bring in more revenue for their programs and initiatives. but typically it's addressing the bigger issue, which is low retention in their programs. You know, sometimes it's low recruitment to get into their programs. Also, sometimes it's like they're not even tracking outcomes for their programs. And so if you're not tracking outcomes, or you believe that you're tracking outcomes and it's not what funders want to see, you're less likely to be funded. Sorry, there's some comments. Let me see. I'm from America. Well, you know, my ancestors probably wouldn't say that. What am I cutting? I'm actually cutting up butternut squash. Trying to prepare a meal for my family later. Let's see. Hello for those who said hi. Sorry, it's so small print. I need to get my glasses. Okay, awesome. Welcome. But yeah, I'm just chatting while I'm cutting up and making this food in between work. Got to be careful as I got this big thing on my hands. I don't know what they let you say and don't say on here, but yeah. Some people want me to get on here and talk about the different types of funding sources for their health organization. So this is great for nonprofits and for-profits. If you have a public health or healthcare program. So I'm just cutting them up in blocks. I probably should make it a little smaller so they cook. But there's so many different types of funding sources. Obviously, you have your traditional loans, but I don't want organizations who are struggling to get into more financial debt, right? We want it to be promised, delivered, and helping them to grow without additional stress. So yeah, you can go the loan way. You can apply for loans. You can get the money on probably same day nowadays. But that makes you get into more of a financial bundle when you got to pay that money back, or you just have a high interest rate. And that's what you don't really want to deal with while you're trying to get out of a bind, because most organizations are waiting until they're in a bind to take action to prevent it, right? It's like, I'm not going to do better with my health and wellness until I get sick. That's not what we should do, right? But we see that most Americans are dealing with a chronic disease and they're not doing anything about it. They're doing the same things every day and not willing to change or do anything to prevent it in the future. So that's the same thing as business. In nonprofits and for-profits, they wait until something happens to make change. And by then it's way too late. We see organizations closing every single day. We see nonprofit leaders, you know, stressed out to the max because they didn't prepare ahead and they didn't know they had to. They thought that funding was guaranteed, and no funding is guaranteed, especially from the government. And I don't mean that like, you know, to never depend on government grants, but it's one of the most unstable funding sources that's available, right? I would say loans are one of the most stable funding sources, but it comes with a big tax. So yeah, I will list a couple funding sources and try to explain them a little bit, but loans are a good one, but it's not really recommended. And then also thinking, before I go into that, most organizations think that they're ready for funding and they're not. They haven't put the plan in place or the preparation in place to be attractive for funding. So that could mean, you know, knowing the impact your program has made beyond the number of events that your organization has attended, beyond the number of people who attended the event or program. It's so much more than that. And I'm actually just putting them in this butternut squash in this. I'm actually gonna let it marinate. And then when the family gets home, we shall eat. But yeah, let me see, there's some people leaving comments. Da-da-da. Okay. Awesome. Let me list funding sources. So we have sponsorships. That's one. I mean, sponsorships can be kind of like that one-off tactic. Like, it works, it's great, but sponsorships aren't a sustainable business practice because you have to re-ask unless you do like a multi-year sponsorship. I think my husband's home actually. So that's a good way to bring in additional funding for your health organization, for your programs and initiatives, to even cover funds for a patient that you want to serve in your program or the community you want to serve in your program. Sponsorships are a really good one. Like, for example, we have a workforce development program. Hold on. I'm on live. I'm on live for YouTube.
Are you really?
Yeah. What are you doing here? You're home early.
Are you being serious?
I'm very serious.
Oh, okay. So they might hear what you're saying?
They can.
Oh, okay.
I don't know how to mute. But yeah. For example, I was able to get sponsorships for people who wanted to participate in our public health mentor program, which is a 8-week mentorship and coaching program for those who wanted to land a job in public health or healthcare. That program is also for those who are looking for, I'm over here making a mess, who are looking for a better position in public health or healthcare, and also those who just need accountability for, positioning themselves to be, in higher paying positions within public health or healthcare. For example, the sponsorships, we reached out to individuals who have been in our network who are dedicated to making sure that professionals are successful in their career. And also, they found our program to be valuable, right? Sponsors don't just invest in anything. They want to make sure that it actually works. And so we use a method called the 3% method. And that means that 3% of people who actually apply for jobs, only 3% of those land interviews. Right? So out of the 97% of people out there who've been applying to jobs, they're not landing interviews. Right? So we help to fix that, and we help people get into better high-paying jobs within 60 days using our framework that has worked for people all over the world. So sponsors see those outcomes, that people have been able to go from unemployed to senior level jobs. They've been able to go from recently graduated to senior level jobs. We've been able to help people get, $20,000 pay raise, $5,000 sign-on bonuses, and so many more other amazing wins in their career that they never thought was possible without additional degrees and certifications. So we the sponsors who saw those outcomes, they paid for their spot, and they were able to, the person themselves was able to participate in that program for free. So sponsorship levels are a good way for organizations to also get additional revenue for their business or their nonprofit without solely depending on grants. So I want you to think about a program or initiative that you know of or that you're part of. Maybe you're the staff, maybe you're the leadership. And hey, are they solely dependent on grants? Are they solely depending on one source of funding? Maybe it's not grants. Maybe they're only depending on clients to pay them, right? Sponsorships are a good option, and anyone, for-profit or nonprofit organizations, can do sponsorships. But again, it's kind of seasonal, it's kind of one-off, it's kind of typically that one-time initiative, that one-time request. And so we help them create a multi-year sponsorship level so that they don't have to worry month over month, year over year about sponsors who can invest in their program, service, initiative, event. So that's one of the revenue opportunities for organizations of any type. But I'm mainly talking to organizations who are in the health and social impact network. So my husband came home, he's like, what are you doing? He's the chef, I'm not, so he's kind of really surprised. And then I have like stuff all over the floor, because, yeah. But making butternut squash, cutting this up, trying to do better with like eating meals, not just snacking. So, yeah. How's it going? Let's see. I am a captain of red-haired pirates. Oh, okay. Let's see. Another service, another funding source that organizations can look into is building online courses in digital products. Like, that is definitely something that if you're not doing already, you're not even awake, like you're asleep. Seriously, because like, why is it 2026 in your organization, whether you're nonprofit or for-profit, why haven't you created digital resources that cost, right? And the thing about it, people's like, why does everything has to charge? Why does everything has to cost? Well, you go to Amazon every day. You pay Amazon every day, right? You go to Starbucks every day. You're doing stuff that's not for your health every day, but these organizations are trying to improve community health and you don't want to pay for it. Hey, maybe it's not for you. Maybe you'll be a part of that people who has to see something happen before you take action. And hopefully that doesn't happen, but organizations have to also stay open to make sure that they're serving communities who need the resource today. And so whether that's you or not, that's not their problem, right? They have to make sure that they have the funds to serve communities who need them today. So there will be services that cost, but digital resources, creating digital resources, whether it's a PDF, whether it's a masterclass, whether it's a full-blown online course, whether it's online coaching about a specific topic, that is a really great source of funding for organizations to consider adding on. I mean, if they got 100 people to buy a $10 product, that is some good revenue. That's covering some costs for organizations, because most of the time their funding or their operational costs are actually pretty low. And that money can cover something, right? Maybe it can cover just outreach expenses for engaging in the community, because some grant funding is limited on what they allow you to spend it for. So if you create a digital product for your nonprofit or for-profit health organization, and you're also looking at grants to cover another part of the company or the operations cost, you can use that funding. You can use the funding that you bring in from the course or the digital product to cover another expense in the organization. I hope that aligns. I hope that makes sense. So yeah, online courses, any organization can create. I'm helping a pharmacy. Well, I wanted to help a pharmacy create an online course. And so they have to wrap their heads around it. They have to understand and know, like, hey, this is such a easy thing to do since you're already doing the work, to do an online course talking about diabetes self-management. Even though they've done that same program on like in the community, there's people online outside of their city, outside of the state, in another country, who would literally invest in themselves to learn from a pharmacist who understands medication, who understands toxicology. Your doctor understands toxicology to a degree, but they're not a pharmacist. They're not a toxicologist. Oftentimes your doctor is consulting with a pharmacist before they even prescribe you medications. At least they should be. So I used to work for poison control. I used to work alongside toxicologists. I worked alongside one of the top toxicologists in the world. And that's a whole nother story, but it was very interesting to know that the hospital systems aren't the same as your specialists. You know, these doctors, the primary care doctor is not the same as a specialist. And so these organizations have a great opportunity to create online programs and digital products to reach more people with education. So think about that one as a revenue source, digital products, online courses, to bring in additional revenue. And literally, I set this up for a clinic not a clinic, but a nursing healthcare organization. I set up an online course within a couple days for them, right? And it was like the wait list, the thank you page, the email automations, tags, sequences, all of that stuff. I can set that up really quickly, and they can go ahead and start making any type of revenue, whatever you price it at, right? We can help you with the pricing models. We can help you with all types of stuff. So, you know, creating online course or digital products is also another amazing way to bring in revenue without, you know, the overwhelm. Let's see. Strategic partnerships is another one. We have this 5-step community impact framework where we typically work with organizations through the 5-step framework. And building capacity is one of them. I gotta cut this and be careful not to cut myself. All right, so capacity building is one. Capacity building is more than funding. It means strategic partnerships, right? But with strategic partnerships comes funding opportunities for sure, or they can actually help you expand your network and introduce you to other partners who may be interested in supporting your work, becoming a sponsor, investing at a higher level for those programs or services. So strategic partnerships are one that is really slept on. This is a big reason why organizations are failing at a rapid speed, because they only have the funders as their partners, right? They only have the grants who have funded their organization as the partners, but they haven't looked beyond that, right? So when these organizations are solely depending on the grant funding agencies as the partners, there's a huge missed opportunity as well. So strategic partnerships are a plethora of people, or like it's a lot of different types of people and organizations. It's not a nonprofit just partnering with another nonprofit. There's also a lot of different types of nonprofits. Not a lot of different types. Well, yeah, there is a lot of different types of nonprofits. Most people only know about 501c3s, but there's a lot of different levels of nonprofits that people don't know or aren't talking about. So having a diverse network of strategic partners can help your agency stay not even afloat, but stay level. Okay, because sometimes you might be staying afloat and your boat is kind of leaning back, but you're afloat, but you're leaning, right? So we want you to stay level and sustainable without worrying about when it comes to the funding. Let me grab a spoon. So now the butternut squash, I have to get the center out. So strategic partnerships can be in your local community. That's typically the only place organizations are looking at leadership of organizations. Strategic partnerships, are outside of your community, outside of your city, outside of your state, outside of the United States, right, in different countries. Strategic partnerships can be at all levels. I'm actually gonna grab a chair. Grab a chair. Strategic partnerships can be at all levels. It can be at the individual level. It can be, and I mean like a community member can be a strategic partner, because you never know what someone can do and what they're capable of doing. So you might have a person who's willing to become a strategic partner and invest in some way in the efforts that your organization is doing. You can also have another organization, so the for-profit or the nonprofit organization, to be a strategic partner, and they can help to fund the need that you have. Maybe you have a need for new staff. Maybe you don't have a need for, programming, because the grant or another funding source is paying for that. But again, some funding grants, they limit how you can use money, right? They might have a very specific thing that you can use to pay, use those grants to pay for. So for example, a lot of grants that I've seen that are funded to organizations do not allow them to spend it on marketing or ads, which makes sense because a lot of people don't know how to have successful ads. And so that would be a waste of spending if an organization just randomly decided to do ads and that grant money was used for it and it was not a successful ad. So though there are limits on their partnerships, can be another revenue source for organizations who want to pay for ads or want to get gift cards for transportation for the community, but the grants limit that opportunity. So strategic partnerships can be within your state, can be within your city, they can be outside of your city and state. It's mostly about people and organizations who are interested in the work that you're doing and they see the impact that you're making beyond just reporting on numbers. They want to see what was the outcome of the patient or the individual who experienced your program or resource. So strategic partnerships are another good one. I love talking about strategic partnerships. Without strategic partnerships, you're putting all your eggs in one basket to, thrive and survive. So sounds like I need to wrap up this live. You guys have a